Minimally invasive spine surgery is a newer technology that allows us to perform the same sort of surgeries we've done previously, but with smaller incisions, which means less blood loss and usually faster recovery. Minimally invasive surgeries usually involve operating through a tubular retractor that allows us to make a smaller incision, and that means less blood loss, less tissue damage, less retraction of tissue, and usually quicker recovery. Because minimally invasive surgery is a smaller incision, that means less retraction of tissues and less damage to the tissue and frequently less blood loss. And most of the time patients can return to their normal activities quicker. They may have less post-operative pain and require less pain medication afterwards. So not everyone is a candidate for minimally invasive spine surgery. For some conditions, the traditional approach is probably the best. For certain conditions such as a lumbar disc herniation or lumbar stenosis causing compression of nerve roots in the lumbar spine, the minimally invasive approach can decompress and unpinch those compressed nerves and do that in a way that requires less retraction and a smaller incision, and usually quicker return to normal activities. The surgical technique involves making a small, approximately 2 centimeter skin incision, and through that incision, a tubular retractor is placed into the tissues to hold the tissue out of the way, and then a microscope and special instruments and drills are used to remove bones, to open up the spinal canal and unpinch compressed nerves. As this diagram shows, the tubular retractor is placed down to the bone, and then special instruments are used to remove the herniated disc or whatever is compressing the nerve root. The recovery is similar to open surgeries as far as the time involved, usually 6 weeks of no heavy lifting or anything real strenuous, no manual labor for 6 weeks. But the amount of post-operative pain and discomfort is usually less with the smaller incision and the minimally invasive approach.